Hi beautiful mama, welcome back to the channel. In today's video we are going to be talking about what you need to pack in your hospital delivery bag. If you're already in your week 37 and you're yet to pack your hospital delivery bag, this video is for you, because from week 37 your pregnancy is considered to be full-term, so labor can start anytime. And between, you're even supposed to have packed your bag when you are in your week 32, 33, 34, so that when you get to week 37, you will just carry your bag and go to the hospital. So for the sake of clarity, this video will be divided into 3 sections. First section will be your list for your baby, second section will be your list for yourself, and the third section will be the hospital requirements, what the hospital actually needs from you, what they will need in the delivery room. So with that much being said, let's get started. Number 1 on the list of things you need to pack for your baby in the hospital delivery bag is diaper. When you're packing for your hospital bag, please make sure you pack diaper. Your baby will actually need diaper, and when packing diaper, look for the size, because there are different sizes of diaper for babies. Size 2 is basically the recommended one for newborn babies. Another thing you need on your list for your baby is the comb, your cream, bodysuit. That's the clothes. Some people call it pin-up. That pin-up they pin down. Yeah, you need it. If you're going to deliver through birth canal, you don't really need to pack much. But if you be giving birth with CS, please pack enough, like 5, 6, 7, 8 should be enough for you. Another thing you need on the list in your hospital delivery bag for your baby is your cotton wool and your spirit. The cotton wool and your spirit, and the spirit will be used to clean the baby's navel. When the umbilical cord has already cut, there will be wound, so you need cotton wool and spirit. So you will need the spirit and the cotton wool to clean the navel. Another thing you need in your hospital delivery bag for your baby is the nasal aspirator. Some people call it the mucus extractor. This is actually used to remove excess water or to remove any water from your baby's nose. Maybe when your water broke, maybe when your water entered your baby's nose, so it's used to remove the excess fluid or water from your baby's nose. In most cases, if your baby has this fluid and they don't remove it, your baby will have difficulty in breathing, to make your baby to be sounding somehow. And a lot of babies are suffering this today because they did not use this nasal aspirator when they gave birth to them. Some children, when you say they breathe, that's because they did not clean their nose properly. So you need this nasal aspirator in your hospital delivery bag. Another thing you need is glucose. For the first 24 hours or 48 hours of after delivery, your baby is likely not to suck. So within that 48 hours, your baby will be hungry. The hospital will ask you to go and get glucose. So where will you be running to go and look for glucose at that particular time? So please make sure you put it in your bag for necessity. Some mothers start lactating immediately. Some mothers start bringing out breast immediately, but you're not sure, or you don't know if your case might be different. So please make sure you buy glucose, buy bottled water, buy feeding bottle or spoon or plate that you will use to feed your baby for the first 24 or 48 hours after delivery. You also need your baby cap, your baby shawl, that is a flannel, and your baby's hand glove. So that is all for the baby's list. Now over to you. What you actually need to pack in your hospital delivery bag is number 1, Comfort sanitary pad. Don't be stingy with this. Most mothers, when they are asked to buy this pad, they'll be complaining that, like my hospital, they will write that you should buy about 7 or 8 of it, that big one. Some mothers will complain that why are you asking me to buy this plenty pad and all that? You actually need it because the first 24 hours of delivery you might bleed very well, and they will use this comfort pad, and it has weight. Don't buy the normal pad because you're going to be bleeding very well, and the normal pad will not actually carry the flow of your blood. So buy the comfort sanitary delivery bag. Most times after delivery, they even insert the whole of the pad in your vagina so that it will absorb more blood. So buy enough of it. You're going to be bleeding for the first 3 or 4 weeks after delivery, so you actually need this comfort sanitary pad. Another thing you need in your delivery bag as a mother is your sanitary pants, the black color, that one that is elastic. You need it. This will help to hold your pad very well, and in case there is blood stain and all that, since it is black color, it will not disturb it. Carry enough wrapper, carry enough free dresses for yourself. Please make sure you pack your phone, your charger, snacks that you will need, and also go with somebody to the hospital, somebody you trust. Like me in my pregnancy days, I always go with my husband. My husband is the one that follows me to the hospital. So if your husband is not around, maybe your mother or somebody you have confidence in, somebody you confide in, can actually follow you to the hospital. Carry your ATM bar, your ATM card, carry cash that will help you to buy little things that will be required of you in the hospital. So the last in the section is the hospital list. What the hospital will require of you. Hospital will need tissue, hypo. Most times I even complain that what are they doing with all this hypo? Can't they use their own money to buy? So they will require you to buy tissue, hypo, disinfectant, delivery mask, so many other things that are in the list, but this does not really have to do with you because it's a hospital that will provide the list for you. Some hospital will ask you that if you bring money, they will help you to get it. Why? Some will give you the list for you to go and buy. So if they give you the list, go to a baby shop or a pharmacy. Some of the items are found in a pharmacy. They will actually give you the they will actually give you the value or the cost of the items. And I earlier mentioned that you need mucus extractor, that is a nasal aspirator for your baby. If you're wondering where you can get it, go to the pharmacy. They have it in the pharmacy. That is where you can buy the nasal aspirator. So that these are basically what you need for your hospital delivery bag. Like I said, if you're already approaching your week 37, please make sure you pack your hospital bag even from week 1 of pregnancy. If you know you're not financially buoyant, you can start preparing for your hospital delivery list. Start picking things one after the other. Once you pick, you put. And early packing of all these things will make you not to forget anything. Delivery time, labor time is not time that you should be looking for things to pick again. So pack your bag, keep it ready so that once labor come, you can just pick your hospital delivery bag and start going to the hospital. So that's all we have for today. If you're just seeing my face for the first time, my name is Daisy Peter. I'm a content creator based in Port Harcourt, and all we do here is give healthy pregnancy tips for your pregnancy journey, tips on how to take care of your baby, and tips on how to navigate motherhood. If this resonates with you, please, I want you to like, comment, subscribe to this channel, and share this video so that other beautiful mothers will also have to know about this channel. Remember, I'm not a medical doctor, I'm not a medical practitioner. All my teachings here are based on experience and on research. Do well to seek out your hospital if need be. Thank you for joining with us today. See you next time in our next video. Bye.